How do seminoma versus non-seminoma affect RPLND for testicular cancer? Imagine two different types of testicular tumors that behave quite differently and requiring tailored treatment approaches. That's where understanding the difference between seminoma and non-seminoma becomes really important, especially when it comes to deciding if a retroperitoneal lymph node dissection is needed. Seminomas tend to grow more slowly and are generally more sensitive to radiation and chemotherapy. Because of this, doctors usually prefer to start with surgery to remove the affected testicle, called orchiectomy. After that, they often monitor the patient closely and use radiation or chemotherapy if there's any remaining disease. RPLND is not usually the first step for seminomas. Instead, it's reserved for cases where chemotherapy doesn't fully eliminate the disease or if there are suspicious lymph nodes that don't respond to other treatments. Non-seminomas, on the other hand, grow faster and are less responsive to radiation. They tend to spread more quickly to the lymph nodes in the abdomen, making surgical removal of these lymph nodes more critical. RPLND plays a key role here, both for staging the disease and for removing any cancerous lymph nodes. Because non-seminomas can produce tumor markers like alpha-fetoprotein and human chorionic gonadotropin, RPLND can help remove residual masses that might not shrink completely after chemotherapy, reducing the chance of recurrence. When a tumor contains both seminoma and non-seminoma elements, it is called a mixed germ cell tumor. These are generally treated more like non-seminomas because of their aggressive nature and the way they respond to treatment. In summary, if you have a seminoma, RPLND is less often used upfront and mainly considered if there's residual disease after chemotherapy or if lymph nodes are suspicious. For non-seminomas, RPLND is a standard part of treatment, especially when there's evidence of lymph node involvement, because these tumors tend to spread faster and are less sensitive to radiation. Deciding whether to perform RPLND depends on the tumor type, how far it has spread, and how it responds to initial treatments. It's always part of a multidisciplinary approach, meaning your care team will carefully evaluate your specific case to choose the best plan. Remember, every person's situation is unique, so it's essential to discuss all options with your healthcare provider to find the most effective treatment for you.